Good evening. Sorry to bring all of this exciting conversation to a close. There's obviously a lot of excitement, a lot of interest in the audience. I just have to say, before other remarks, that this is an entirely different event than has been the case here for my previous three presentations. The energy is so exciting. All of the partners who are represented in the audience, members of the community, students who are here, community physicians who are here. It's just fabulous to feel like we're part of this great community. And it's a lot of what I'm going to talk about tonight and the consequences of that. All the good things that are happening, some of the uncertainties that will come with that. So I welcome all of you. I appreciate the opportunity to come before you as I have in the past. I believe it's a great privilege to come to you and describe the many great things that are happening with the school. I believe it's a responsibility to come to you to talk about some of the uncertainties and some of the things that we will face down the road. I want to recognize several distinguished guests who have honored us with their presence tonight. First, Provost Kevin Carman and President Mark Johnson, who are here with us tonight. I want to recognize Rob Winkle, who's the chair of the board at Renown Health, and Tony Slonim, who we're recently welcoming to the community as the new Renown Health. Where was Rob's hand? I didn't see it. Comment that Rob has a particularly personal interest in the medical school and is probably sitting in Trent's seat at the moment over there. So that's very exciting. I want to recognize several other renowned leaders who are here. I appreciate the turnout tremendously. Several members of the board and part of Dr. Slonim's leadership team, and I appreciate your presence as well. I want to recognize Mike Johnson, with whom we're working at St. Mary's on the Family Medicine Residency Program, and recognize the support from Helen Lidholm and St. Mary's as well. So, NPR, several months ago, had a little exercise. And the exercise was describe your job in 5 words. And I thought about that for a bit and decided to take on that challenge. And here is my answer: improving Nevada's health and healthcare. I think that's my job. I think that's your job. I think that's the school's job. I think it's the job of our leadership in the state, of the Board of Regents, of the higher education system. That, I believe, is what should define the decisions we make and how the school goes forward. I think we're here for statewide service. We're here for other aspects of science and teaching and other ways that we will contribute to the larger world of medicine, but I think we are fundamentally here for statewide service. Public higher education serves the state in many ways, and institutions serve the state in many ways. The School of Medicine has served the state in different ways over its history. In its early days, it was a single statewide school based in northern Nevada, connected to the community. Community physicians were involved in teaching, some relationship with the local healthcare institutions, reached out to rural areas, had a fairly clear position, a very fairly clear mission and vision. Over time, for a variety of reasons, economic, political, and otherwise, things changed. And the school became more statewide in its reach, but less solidly grounded. And it evolved into 2 half campuses. And that persisted for many years and is what I, in a sense, inherited when I came 3 years ago. And that arrangement was unsatisfactory for a variety of reasons. It was unsustainable. It had no opportunity for growth. It was unsatisfying to students. It was unsatisfactory to faculty and staff members. We served no community well. It was distracted from our rural responsibilities. It was not a proper way to structure the school. And it led to the politicization of what I think are fundamentally academic and scientific and educational and clinical decisions. And it was very destructive to the school. I think over the past year, good things have happened. A statewide public Medical Education Advisory Group has come together under NSHE's leadership, under the Chancellor's leadership, with UNLV and UNR and the School of Medicine represented. And that has led to a memorandum of understanding and some amendments to that MOU that I think will guide us into the future. The interim structure, as you know from that MOU, was that there would be a single statewide school with 2 full campuses. And that did not hold politically and philanthropically and for other reasons. And I think we accepted the fact that we could not be everything to Las Vegas that Las Vegas wanted. And so the process moved us towards a second medical school in Las Vegas at UNLV and a restructuring of the University of Nevada School of Medicine. So here we are at this point with that history, and the question is, what does that mean? I'll digress briefly to comment that last night I was giving this presentation in Las Vegas, and I think there are some interesting contrasts here. Historically, I think a lot of the focus has been on how to serve Las Vegas, political issues, things that you know about. And I think that that has not served Reno well in the sense that there are equally critical and major issues that face us here, and especially now that we have this incredible focus and incredible opportunity and incredible challenge to build a full campus here and to be the School of Medicine here that I think Northern Nevada and Reno and UNR want. And it would be easy to be distracted by what in a sense is a major restructuring in Las Vegas that is felt as a takeaway and ignore the incredible change that will take place here. And that's how I want to structure my comments tonight. So I want to answer 3 questions. What is the School and how does it serve? Where is the School of Medicine going? And how will we get there? The timing of this presentation could not be better, although I have to say that things are moving so fast that if I give this presentation next week, it might be different all over again. There's a lot moving and a lot happening, and this is a moment in time, but I think it's a really critical moment in time. The state's needs are incredibly pressing. Our rankings, as you know, are poor. The quality of healthcare is highly variable. Capacity for healthcare is low. There is considerable outmigration of healthcare that could easily and should easily be provided in the state. Medicaid expansion is going to stress the system tremendously. We know that the quality of healthcare is a major driver of economic growth and success. And yet we are woefully unprepared for that. So this is a critical point in the school's development. It's a critical point in public medical education development. What I would like to do is to lay out for you a very detailed plan, be very reassuring, be very comforting, describe for you this seamless transition to a future state. And I can't do that. Above all else, I can't do that because there are several critical contingencies between here and there that have to do with the Board of Regents and their continued endorsement of a plan moving forward, the governor's budget, which has a major proposal for increased budget for all of public medical education, including the School of Medicine and residency and fellowship training, for which we are sponsors, and the legislature. So in actual fact, we won't know till next May how this is going to play out. But this campus will develop no matter what, and it will do that because of some of the people in this room. We have an opportunity, even without fully knowing legislative support, governor support, regent support, what the opportunities are here to partner with community physicians, to partner with Renown, to partner with other institutions in the community, and to partner with the community. And that is what I want you to hear tonight, that this is finally the point after 15 plus years of misery in not understanding who we are and where we are and who we're serving and where our partners are. We can finally do that now. And that's going to happen, and that's very exciting and very stressful. So what I do want you to hear and what I want you to take away is we're about to enter a amazing phase of change. We have tremendous needs. We have tremendous opportunities across the state. People ask me every day, how are you doing? And I say, I'm doing great. I said, there's a lot going on, and it's all happening at the same time. And you can't sequence this. You can't say, well, that's a really good idea. Let's do it next year. All of it has to happen because it's all part of a piece, and I think it's all going to happen together. This school is going to look dramatically different 5 years from now. And I think we have to figure out how that's going to look and how we're going to get there. The issue is not lack of choices. The issue is lots of choices, and some of those choices are very difficult. Exactly how we're going to change is unknown. Lots of uncertainties, and even uncertainties about uncertainties. We don't even know what we don't know about unexpected events, unexpected barriers, unexpected opportunities that will pop up. So I feel like a tremendous amount of work over the past 3 years has come to this point, and it's time to take advantage of that. I know there's lots of fear about change. I would suggest that there should also be fear about not changing. I know it's comforting to sort of stay where we are and to stay with situations that are familiar, even if they are not satisfactory. And I think we cannot do that. I think we have an opportunity to do something truly astonishing here across the state, and I think it's time to take advantage of that. So let's talk a little bit about the school. Who are we? How do we serve? We talk a lot about campuses and facilities and affiliation agreements, and those are all interesting, and they are a means to the end, but they are not the end itself. What we are is people, and who we are is all of you and everybody who's connected with this school, and who we serve and how people are serving people is what we're about. So I want to deal with that both kind of big picture and little picture. So you have a couple really cool things in front of you, fact sheets front and back and some highlights, and I just want to highlight a few of the highlights, if you will. So who are we? Number of employees this year, meaning faculty, staff members, adjunct faculty members, 1,746. That's who we are. On top of that, number of trainees, meaning residents, fellows, grad students, postdoc fellows, medical students, 747. So you add that up and it's almost exactly 2,500 people, and that's who we are. And that's the group that serves the state. That's the group who conducts the research, who sees the patients, who teaches. That group is supported by a budget of about $177 million. And you can see on the back side that money comes roughly 40% from clinical practice, roughly 20% from the state, roughly 20% from hospital affiliations, a little less than 20% from research grants, philanthropy, tuition make up the rest. We saw 344,000 patients last year. We provided 75 CME events across the state. 7,500 healthcare professionals took advantage of that. A tremendous accomplishment. You can see our alumni body, 1,883 physicians to this point, and with all other students in the health science or in the medical school, over 3,000 total alumni have come out of this school over its history. So that's who we are in terms of numbers. I want you to take a look at this a little bit and just look at a few of the highlights. There's so many good things on here. Let me just highlight a few of the highlights. So workshops to promote health professions to Native American students, pipeline programs that dig into the high school to try to encourage students to pursue a career in medicine. A huge clinical and translational research grant that's actually based at UNLV, but for which UNSOM is the major partner. $20 million over 5 years to support clinical and translational research. It had its 1-year anniversary yesterday, and it's an astounding success in terms of the pilot grants and the infrastructure and the support that it's provided across the state and across the West. I want to highlight Dr. Sanders and his achievement. He is one of the most highly funded biomedical scientists in the country, has one of the longest track records of continuous funding, now continues on for 5 more years with a major phase 3 grant from his previous COBRA. The Patient Care Center opened in Henderson. I know that doesn't affect you immediately, but I think you should be excited about how big an accomplishment this is to develop a full multi-specialty group practice in a very important part of Las Vegas. Some of you may wonder why the launch of the electronic medical records is on the highlights page. I would suggest that even with all of the misery that goes with that it's a big accomplishment and that it's important to recognize that we have now entered at least closer to the 21st century with regard to our clinical IT support. We honored rural health champions with a major event last fall as part of the state's 150th anniversary. I want to recognize the tremendous work that's gone into the website. I trust that all of you are excited about how we are portrayed now on the web. More than 10 years of no modifications, no updates, and we now have a new, flashy, very functional, very exciting web platform, and that's a huge accomplishment. We did a health disparities symposium in collaboration with UNLV, one of many collaborations we're trying to encourage there. And some big agreements. So we are working on an affiliation agreement with Mountain View Hospital to launch a major GME affiliation there. That, I think, is incredibly exciting for all medical students. It'll be new opportunities for UNSOM students, and that's a huge step forward. And of course, right below that on the list is the major partnership with Renown Health, and I'll talk about that a bit more in a few moments. Surgery department received accreditation for its orthopedic surgery residency. This is a huge step forward in terms of new program, incredible demand and incredible need, and a program that is not just going to happen by itself. It takes a lot of hard work and scraping together our pennies to try to support this. I want to highlight our faculty members who were selected for major fellowships. So Tim Baker, who's here, Tom Hunt in Las Vegas, were selected for a major educational leadership fellowship sponsored by the AAMC. They were 2 of only 13 people nationally who were selected, a huge honor. And right with that is Dr. Vanny Dandaloo, the chair of OB-GYN in Las Vegas, who was selected for the ELAM Fellowship, the Emerging Leaders in Academic Medicine, which is a very high-profile fellowship for academic leaders. Kirk Bronander, who is here, was honored as the E.W. Richardson Teacher of the Year. We honored healthcare heroes last week with Dr. Baron, Dr. O'Coin, Dr. Barden. And finally, some philanthropic announcements, which may come as a surprise to some of you, but some very exciting things that are happening. The first is that in our partnership with Renown, we are about to launch, under Jennifer Hagan's leadership, the search for a new chair of pediatrics who will also serve as pediatrician-in-chief at Renown Children's. And that's a very exciting combined position that I think is going to be the first tangible manifestation of our relationship. And as part of that, the Redfield Foundation has agreed to support that to a very high level for many years to come, and that position will actually be a named chair as the Nell J. Redfield Foundation Chair of Pediatrics. The other highlight that I will announce here, which I think is news to even more of you, is that Dr. Mitch Hitchcock, who is a noted scientist and entrepreneur in the biotech field, has just announced that he will endow a full chair, a professorship in biochemistry that will reside in the medical school. And it's an endowment beyond just the salary support. It will support programmatic support, postdoc fellows, and laboratory support. And that's an incredible commitment on his part. So when you see Nick, you can thank him. So those are some of the big picture issues, and much more to celebrate beyond that. And I suppose we could just stop there and just celebrate and say all of those wonderful things, but I have a few more comments. In addition to the big picture, I want to just say something more personal. That is that I have the privilege of recognizing great things that all of you do every day. And I see all of the little acts of kindness and the random outreach that takes place that helps somebody, and the way we help our students and our residents and our patients and each other. I see the extra effort, I see the pride in the School of Medicine, I see the mentorship that takes place, I see the collegiality, I see the partnership. And I want to make sure that at least once a year that I acknowledge that and thank you for that. And I want to acknowledge in particular at this point, which is appropriate, Ryan Jers and Audrey Goodnight, who have managed all the logistics for this event and do such a great job, and Edgar Nunez, who is responsible for the slides. So I think that we have reason to celebrate just by virtue of the good things that go on here and the opportunity to work together and the opportunity to serve. And I consider it a privilege to be part of this group, and thank you for that opportunity. So I think that there are many ways that we serve. They're big picture, little picture. They all come together to describe, I think, an extraordinary institution that does amazing things for the community. But that sets the stage for where are we going. I want to talk a little bit about Las Vegas because I think it's important that you know what's happening there, and then we'll talk more about Reno. There's going to be a major change in how we define our presence in Las Vegas, and that will more directly affect people there, but it is part of the school, it is part of us, it is all part of us, and I think it's important that we all understand what's happening everywhere in the state. I think there will be some grief over the changes that are taking place because it's not going to be the full campus and that people were looking for, and there will be tremendous transition with UNLV forming. I expect what will happen is that we will downsize our clinical teaching capacity there over the next many years. Not right away, all of this is 3, 4, 5, 6 years down the road. But over time, as we develop the campus here and develop capacity here, I think capacity will decline there, but not to zero. It's critical that there still be exposure to Las Vegas. There are tremendous teaching opportunities, urban underserved medical care, some specialties for which the teaching is tremendous. Not that we can't recreate that here, but it is so good and so well established. Plus, we want our students to see the residencies in Las Vegas, and that's a critical component that we have to keep in mind, that students need that exposure either in clerkships or in fourth-year electives. We're going to continue to work hard to build a relationship with UNLV. I want this to be a collaborative public medical education event, and I think that's the proper thing to do. I think that's the collegial thing to do. I think that's the professional thing to do. The Mountain View residency program is going to be huge, not with controversy. I won't get into too much of that here, but you will hear about this from time to time as to why we are sponsoring those programs. The short answer is because we're the only sponsor in the state at the moment and for the foreseeable future, and we want to take advantage of that. That's an opportunity that we do not want to go lacking. I think that's part of a larger issue, which is the overall issue of GME quality, and I'll focus a bit on Las Vegas in that regard, but we really have huge issues across the state in terms of our ability to invest in GME or a lack of ability. As some of you know, there was an editorial in the LVRJ a couple of weeks ago about residency quality. There was a US News ranking that was released of residencies around the country, and what a surprise, Nevada was not in the top 20 in any specialty. Well, if you look at the top 20, that's a league that we just do not play in terms of the ability to invest. We have great teachers, we have great clinical platforms, we have great basic training. We do not have the ability to invest in clinical research and the extra experiences that residents have and the visiting professors. I told somebody that there are programs in the country, and if you look at this list of top 20 programs, they have a visiting professor, a distinguished professor from somewhere else in the country that comes to their program every week to present. If we can afford that once a year in most of our programs, we're lucky. That's the difference between the top 20 and where we hang out. But that doesn't mean we can't get better, and I think the whole issue of GME quality is going to take a lot of attention over the coming years. So that's a little bit about what's going on in Las Vegas, but I think it's important that you know about that. Let's talk about Reno. The issue in Reno is what I said earlier. We suddenly have the opportunity to build a full campus, full partnerships, to be a major partner across the community with community physicians, with Renown, with St. Mary's, with Northern Nevada. We can do amazing things here that for a variety of reasons have been difficult to do in the past. We will have multiple partners. We will have partners at different levels. But we will be a campus for all of Reno and for all of Northern Nevada. Renown is obviously the most major of those relationships. A large, thriving, integrated health system that provides enormous opportunities to be the academic medical center that we need to build that out. We have already engaged in many areas. Pediatrics I already talked about. Dr. Rothrock, Dr. Lopez are here to talk about neurology and the neurosciences and the ways to connect the Institute of Neurosciences as our new department of neurology. Hospitalist integration, I think, is another area. Dr. Slonim and I have 10 things at least on our list for other areas where we come together with Renown. Most recently, talking about research administration and ways that we could be helpful or ways that we can join forces, ways that we can enhance the conduct and the approval and the support of clinical research. And perhaps most tangible would be talking about a medical education building and talking about ways that there's an actual physical presence by the school on the Renown campus. St. Mary's, we're talking in great detail about a new family medicine residency program, which is an incredible addition to the community. And I'm very pleased to note that Helen Lidholm, Dr. Slonim have come together to understand a community-wide oversight of those programs so that it's done on a community basis and on a collaborative basis rather than a competitive basis. I think you'll see GME expansion from these partnerships. Family medicine I just mentioned. PEDS will come out of the with Renown Children's. Neurology residency I think will blossom soon. There may be potential for fellowships on top of that. The key issue is clinical teaching capacity. That is the crux of what we're going to be doing for the next several years, which is how to build a full component of clinical clerkships in the third year, electives in the fourth year, and have basically full capacity for students here, in addition to tapping into some of the selective experiences in Las Vegas. The partnership with community physicians, which we did have many, many years ago in the 80s and 90s, that then sort of went wandering a bit, that has to be recovered, has to be rejuvenated, has to be enhanced to a dramatic degree. The world of medical education has changed, and just giving the student the name of a physician and say, you know, head on out there and see if something good happens is not how this is going to work. This is going to be a structured, intense, high-level, high-class, high-quality, community-based curriculum, which will position us in an incredibly exciting way as a research-intensive, community-based school, which might be truly unique in the country. The way that will come about is through an Office of Community Physician Faculty Engagement that will be physically housed in Renown, signed appropriately, very accessible to medical staff, that will be one-stop shopping for faculty appointment and promotion and evaluation and paperwork and scheduling and troubleshooting and everything that goes with the assignment of students. We've had a tremendous outpouring from community physicians of support to to contribute to this process. And I can't wait to get this office going, again, with support from Renown to really capitalize on that energy. I want to talk a little bit about basic science research. I think that this gets too little attention. I think we, to some extent, take for granted the incredible basic science research enterprise that we have. This has required investment by the state, by UNR over 40 plus years, and it's grown to an incredibly impressive level. Not the biggest research portfolio in the country. There are obviously heavy hitters that have huge portfolio, but on a dollar per faculty member basis, we rank at extremely high level. And we have some of the top scientists in the country and in the world doing amazing work, and with a pipeline coming along behind. So I think we have to make sure that we preserve that precious resource. I think it requires continued investment, and we have to figure out how to do that. I think philanthropy will be critical. Matre have contributed to that. You heard about the commitment by Mick Hitchcock for this endowed professorship. We have to be great stewards of research space and look very hard at how space is used and how we can make maximal use of that space, and do whatever we can to try to continue to support that, because it is one of the things that truly distinguishes this school, especially from other community-based schools. With that, I want clinical research growth as well, so that we have clinical research to partner with basic scientists and have the connections that I think will be very synergistic and very invigorating. The Redfield Foundation has supported that. There are other donors, I think, who are interested in doing that. And I think we've got to figure out, and now that we're firmly based here and can work around the basic science research infrastructure, figure out how to partner like that. Now, let me talk about the part that probably is most anxiety producing, and that has to do with our clinical programs and the clinical integration that I think needs to take place. It would be silly, I think, for us to think that this is just all happy and wonderful, and building a campus here is positive all the way around. What it's doing is calling into question the way our clinical platform is organized. And let me talk about this a little bit. Practice plans are, in some medical schools, sort of the coin of the realm. It's the way that medical schools drive a lot of their funding. It's the educational platform for the medical school. And so there's always this sense that practice plans are, by definition, a great thing. Well, they are if you have the high margin, high remuneration, highly reimbursed specialties to drive that. Surgery, surgical specialties, cardiology, GI, peds ICU. That's what drives practice plans. We don't got those. And that's a huge problem. And this practice plan is not properly constituted to ever be able to generate the margin that will be invested in academic programs. That's the whole point of practice plans in schools that have them. And we are not able to create that kind of enterprise. So the question is, where do we go with that? Well, somewhat paradoxically, the fact that we are primary care only, which is a liability if it's managed by itself, becomes a great benefit and a great resource if it is linked to an integrated health system. And that's why we have to explore with Renown the opportunities to do that. I understand that this creates great angst, and I fully appreciate that. And I promise that we will do this in careful ways, and we will do this in measured ways, and we will preserve our academic mission. We're not talking about selling off. We're not talking about faculty members being employed by Renown, but we are talking about taking advantage of Renown's clinical operations, their operational expertise, management services, ways that we can benefit from their system. Because the fundamental issue is that primary care as a standalone entity is reimbursed extremely poorly, but primary care as part of a health system and contributing to ACO development and other networking can be a great advantage. So we have a resource barrier. We have to figure out how to make that work. I can't say more at the moment. There's a lot of work to do. There'll be lots more discussions about that. But this is where a lot of the anxiety comes from, and I recognize that. And I promise you that we will deal with this in a positive way that supports our teaching and supports our academic mission. Rural campus. Here's Dr. Klass's smiling face. The face of statewide initiatives, the face of Project ECHO, and the face of outreach. As I've said before, we run a great risk if we forget our third campus, our rural campus, and our rural communities. Project ECHO, I believe, is about to explode as a major venture, and Dr. Klass and his staff have taken this on and brought this to a certain point where I think it's going to become a huge outreach service and generate huge visibility for the school. It's gotten the attention of the governor's office. There are many legislators who know about it. It's been presented to the Board of Regents. I think good things are going to come from this. And this will link with everything else we're doing in sending internal medicine residents to Elko and the rural family medicine residency at Winnemucca and our rural preceptorships for students. And I just want to make sure we always remember what we're doing out in the rural areas. So, how will we get there? How are we going to manage this process? I'll go back to the three principles that I introduced last year. ATP, accountability, transparency, and partnership. I think we've made some progress in these three, not as much as I probably would like, more to come, but I think that we're going to stay with this, that this is a set of guiding principles that I think will help. The issue with accountability is metrics. We have a lot of work to do yet in measuring clinical performance, clinical quality, educational productivity, research-based productivity. We have a lot of work in this regard yet, but it's in play, and we have energy in this direction, and we have some accomplishments that are starting to come into being in this area. The issue of accountability is always a two-way street. So we have accountability by the School of Medicine to all of you, to faculty and staff members and the members of the school, to be faculty and staff-centered, to provide appropriate and productive work environments, to have a sense of energy and a sense of direction and a sense of vision. But there's accountability by all of you to the school as well. Your pride in the school, your pride in being part of the school, the collegiality, professionalism, the ways that you contribute to the environment in the school. There is accountability externally. So the school has significant accountability to the state and to our external partners, of which we now have many. And we have many complex agreements and many commitments to many partners, not to mention the state as a whole. And remember again, we're here to serve the state. So the issue to some extent in some of this accountability externally is not being what we want to be, but being what we need to be, and being clear about what we need to do to serve our external partners. And conversely, our external partners have a commitment to us. And this is going to take center stage, I think, in the coming months as we seek further endorsement and further support from the Board of Regents, and we seek support from the governor for budget enhancements, and we see what the legislature will do in that regard. So between now and next May, it's going to be a wild ride in terms of understanding how the state's going to come together around this incredible vision that is now shared across the state. It's not just ours, it's higher education and a public medical education vision. And bringing that to fruition is going to take a lot of work. Second component, transparency. Again, some progress, not as much as we would like. There's transparency of resources. I think we still have some work to do, making clear to chairs and to faculty members how we make commitments with state support, how we support education, how budgets come together. I think there's still probably too much sense of mystery about how that $177 million comes together and how it supports programs. So I think we have some work to do there. I think we have some work to do on performance, transparency of performance. I think our evaluation system is good, but still has a ways to go. And then transparency of processes. How do we conduct our affairs? How do we make decisions in other areas? I want to highlight something that is very exciting to me, the first of two projects that are coming out of Faculty Forward under Jennifer Hagan's leadership. And this is sort of in the category of you asked and we did. And this is the first of two. So the first one is this. It was clear to me when I first came that there was a huge problem with the physician faculty track, that it was poorly described, poorly named, criteria were unclear, promotion was unclear, roles were unclear. Explaining this track to UNR and to NSHE was difficult. And I knew that, but I didn't know how much it affected people until we got the Faculty Forward data. So the Faculty Forward survey, which most of you completed, is informing us about how critical it is to work on this track. We already have some ideas floating around. We've consulted colleagues around the country because other schools have done this well. And we're going to start to come forward to department faculty meetings and town halls and other places to get feedback about what this track should look like and how to put it together. So that's one real concrete thing that we're going to bring forward. Partnership. Major forces affecting these partnerships. One is this. We almost could not talk about our relationship, our academic relationship with UNR until fairly recently, because it generated a whole host of statewide fuss. Now we can do that. It's very clear that we are Reno-based, UNR-based. This is the home of the medical school. We're going to have significant outreach on a very targeted, very selective basis to Las Vegas, which I think is the way to structure this. But we can talk, I think, more clearly about who we are and where we are. I would emphasize this issue of strategic outreach. I think, in general, what you're going to see over the coming years is a lot less of this sort of everything for everybody, but not necessarily anything for anybody. That we have been trying to be something everywhere that we just could not be. And I think we can be much more clear about where we're based, what community we're serving, as well as our targeted outreach to the rest of the state, and much more clear about our positioning, very clear resources, very clear partners, very clear objectives. Just think about the external partnerships that we have now. And we had some of these before. Some of them were not fully developed. Some of them are not as robust. Some did not exist at all. So just think about this. Renown St. Mary's, Carson Tahoe, the Reno VA, Community Health Alliance, hospitals in Elko and Winnemucca, UNLV, University Medical Center, the Las Vegas VA, Mountain View Hospital, Sunrise, and our county medical societies, not to mention the community physicians, especially in Reno, who are going to contribute to school, and many, many more partners beyond that. That's what it means to be a community hospital. I mean, a community medical school. But I want to focus on internal partnerships as well. And I could name several that I think need some attention and need some work and would benefit from some focus in how we conduct our affairs internally. Physician partnerships, for example, and how we work together, how we build clinical teams, I think could deserve some attention. The relationship between medical student education and GME and coming together around a more unified educational pipeline, I think would be good. The partnership between basic science and clinical science, I already mentioned. I think there's tremendous opportunity there. Partnership between the dean's office and finance and administration and clinical and basic science department administrators is another area that we're looking at. But maybe the biggest one that I want to highlight is the teacher-student relationship. We have looked very hard at the exit questionnaires from medical students, the questionnaires that they complete as they're graduating from school. And we're looking in particular at the mistreatment issue. And we score remarkably well in that regard, but not zero. And zero is the goal. This is, there is no level that's acceptable for inappropriate treatment of students. And so I think we're going to work very hard this year and the coming years to develop a more positive learning environment and to have the kind of environment that actually pervades all of our working relationships and the way we come together to accomplish our missions. This leads to another program out of Faculty Forward. So this is the second of two concrete programs that have come out of that survey. And this has to do with mentorship. The survey was very clear that faculty members hungered for mentorship relationships. And those who had those relationships were in general more satisfied than those who did not. I think we need to work on that. I think that's part of what makes a medical school is the mentor-protege relationship. So what we're going to do, again, under Dr. Hagan's leadership, is develop a pilot project related to project-based mentorship. And we're going to put some money into a competitive grant process in which projects can be proposed that will involve mentoring relationships. And we will create those relationships, we'll support those relationships. There will be a curriculum that goes with that, and we're going to try to advance that value system within the school to the extent possible. All right, so let's wind this together. The state of the school is very strong, and it's one of the most exciting phases, as I have understood the history of the school. It's one of the most exciting phases, I think, for the school's entire history. The opportunities and the potential for doing great things is fabulous. Tremendous uncertainty. So let me comment on that a little bit. First, I want to distinguish between uncertainty and instability. There's a big difference. It's one thing to not be clear about what's going to happen. It's another thing to wonder if we're going to fall off a cliff. We're not falling off a cliff. Great things are happening, maybe too many things all at once, but it's all good. But it all has consequences. Again, we're still going to need support from our external political system, so there's uncertainty built into that right off the top, but I think that will clarify itself over the coming months. I think there's still uncertainty that can be generated by continued conflict within the public medical education system. We have to work very hard in this statewide advisory group to manage the relationships, because if those relationships break down, then a lot of this is going to get very messy and very ugly politically. So I think that working on those relationships and staying together around serving the state is critical. Here's the major source of uncertainty. There are so many good things happening that we have lots of opportunities to say yes. Every time we say yes, we also say no to something else. So there's going to be a lot of tough choices to make. Lots of opportunities, lots of decisions, lots of consequences to those decisions. What is more certain? Several things are very certain. Our role is absolutely certain. We are here to serve the state. We are here for our fundamental educational missions. We're here to serve patients. We're here to conduct research. We have a very clear purpose in why we're here and how we're going to serve our constituents. I think what also is certain is our partners and the nature of those partnerships and the purpose of those partnerships. Things are moving very, very fast. If you just think about where we were a year ago and all the things that I've talked about tonight that didn't exist a year ago, and the opportunities that come from that to develop new programs, new sources of funding, new teaching programs, new clinical programs, new research programs, the philanthropic support that's come forward. The partnerships are extraordinary, and our job is to figure out how to manage those. I think what's also certain is our value. I think that has not been clear to the political system in the past, and I think we've been successful over the past year or two in helping regents and legislators and others to understand the value of the school. And I think what's also clear is our values. So here are some core values. Our fundamental value is to serve the state. We will do that through quality at the deepest level. I think that we have, to this point, had perhaps a somewhat inordinate focus on quantity and just doing stuff because we're trying to do as much as we can for as many constituents as we can, and now we get to focus a little bit. Now we get to do it in a little more targeted way, a little more high-quality way. And finally, I think the success of public medical education is a core value. And what I mean by that is, I believe, as I did 3 years ago, that if we do this right, we can actually make public medical education and this school part of a focus that brings the state together around state needs, state healthcare quality. I know that seems a bit of a fantasy from time to time, but I truly believe that can work, and that we can actually do something here that makes public medical education a powerful force within the state. This is who we are. So thanks to Jessica and some of our IT support, you were surveyed about your unit, what are you part of, How do you identify with a department or some type of unit in an academic setting? And who are you connected with? Who do you relate to? What other units do you relate to? This is what you said. This is what we do. This is who we are. If you wonder why things are a little messy around here sometimes, this is why. My point in this is that this is an incredibly complex organization. And it needs to be this complex because of what we do, the intersecting missions, the sometimes competitive missions, the ways that 2,500 people come together every day to do incredibly complicated things means the organization is going to be a little complicated. But it all comes back to the challenges and the opportunities that we face to improve Nevada's health and healthcare. So I think if we stay together, if we understand who we are, if we understand where we're going, we understand what our purpose is, we have the opportunity, we have the great good fortune to do something truly incredible, and that is to improve Nevada's health and healthcare. I look forward to working with you over the coming year to do that. Thank you. I'd be willing to take a question or two. We have a minute. Or we can go have more cookies. Can't hear. No. Uh-huh. Absolutely. So I commend the governor and his leadership team for taking on Medicaid expansion. Governor Sandoval stands out as one of, I think, two Republican governors in states that voted for President Obama, if I have this correct, that went for Medicaid expansion. And that means that there are at least 300,000 new Medicaid enrollees now, and I think it will go to probably 400 or 500,000. Huge influx of patients into the healthcare system, and a healthcare system that was already inadequate and is now wholly unprepared. And I think the school has a role in partly providing that care, but also really getting hot on the issue of training and developing pipelines of physicians to expand primary care in particular. Geriatrics will be huge. Mental health care will be huge. I think there's going to be a significant emphasis on the part of the governor's office to support those programs, especially residency and fellowship training programs. So I think we should be bigger to be able to do that. There should have been investment for many, many years. We're now going to try to catch up as best we can. But this is going to be a huge transformation in the state's medical care system. And if we don't respond as much as we can, we end up just giving 500,000 people a Medicaid card who end up in the emergency room, which is really a disastrous outcome. So we have a lot of work to do in that regard. All right. Thank you all for coming. Safe travels.